Let us see this question. One 52-year-old man, he has presented to the clinic having problems controlling his blood pressure. Despite taking, he is on 3 antihypertensive drugs, ramipril, indapamide, and amlodipine. Over the past few weeks, he has been monitoring his blood pressure at home, and it is rarely below 155/90. That is uncontrolled hypertension. On examination in the clinic, his blood pressure is 160/95, pulse is 85, and it is regular. He has a left carotid bruit. Respiratory and abdominal examination are unremarkable. Investigation showed hemoglobin 12, WBC platelets are normal, sodium potassium normal, creatinine is elevated. So it will be you have to convert it into milligram, you have to divide it by 88, then you will get the creatinine value in milligram percent. So it is elevated, so he is having renal failure. Then renal ultrasound was done, which showed significant size discrepancy. Left kidney is 2 centimeters smaller than the right. Which of the following is the most appropriate investigation to confirm the diagnosis? So the choices include Duplex ultrasound scan, contrast CT, IVU, traditional angiography, and magnetic resonance angiogram. So let us see this question in detail. He is having, this is a 52-year-old man. He is coming with uncontrolled hypertension, and he is on 3 antihypertensives, and his blood pressure is not controlled. So what will you suspect? So this is, when will you suspect renal artery stenosis? You suspect renal artery stenosis when the patient is having onset of hypertension after the age of 55. Otherwise we think of essential hypertension. Here his blood age is 52, so it will not fit. Then difficulty in controlling blood pressure, and patient even with 3 drugs, of which one should be a diuretic. He is on a diuretic, that is indapamide, and his blood pressure is not getting controlled. And on examination in the clinic, he is having a left carotid bruit. What does it mean? Carotid bruit means there is stenosis of the carotid artery. That means atherosclerotic vascular disease involving the carotid. Then the investigations, the other significant thing is creatinine, that is 182 micromole per liter, so which is equal to 182/88 milligram percent. Then you will get a creatinine in milligram percent, that is elevated. Then ultrasound is done, which showed significant size discrepancy. Normally left kidney is larger than right. Here in this case left kidney is smaller than right, so it is definitely it is a contracted kidney. So you get contracted kidney or small size kidney in one is congenital hypoplastic kidney, second is renal artery stenosis, and third is chronic pyelonephritis. These are the common things which cause asymmetric kidneys. So left kidney is smaller than the right, so that means he is having asymmetric kidneys. So with these findings, what is the diagnosis? So in this situation, diagnosis is renal artery stenosis. So we are suspecting renal artery stenosis. So for making a diagnosis of renal artery stenosis, what is the best investigation? That is a question. So first what we can do, that ultrasound scan, Doppler study, that is an investigation which can be done to make this diagnosis. But the problem is this Doppler study is observer dependent. So that means who is doing the study. Then also in obese patients and all those things, it is under-labeled. So it is not the good method to make a diagnosis. Then next is contrast CT. Contrast CT or CT angiogram we can do, that is useful, but problem is patient is already having renal failure. So contrast nephropathy, when you give contrast, his renal function can deteriorate. That is the other problem. Then third is IVU. So this IVU is not an investigation to make a diagnosis of renal artery stenosis. This is done to look for stone and all those things. Intravenous urography, that is done to detect ureteric stone, bladder stone, etc. Then next is angiography, traditional angiography, that also requires exposure to dye. So best exposure to dye or contrast, so that can worsen the renal failure. Then only choice left is MR angiography. MR angiography is an investigation which can be done to make a diagnosis of renal artery stenosis. But only problem with the contrast MRI or the contrast used for MRI is gadolinium. So this exposure to the gadolinium, it can cause, in patients with renal failure, it can cause nephrogenic systemic sclerosis. So also called nephrogenic fibrosing dermopathy. It is a condition which will result in findings similar to systemic sclerosis, whatever we get in systemic sclerosis, that is usually seen on exposure to gadolinium, but it is reported only in patients who are on dialysis, that is those with end stage renal failure only. So it is a rare complication. So MR angiography is the best method in this situation to make a diagnosis of renal artery stenosis.